Good evening, everyone. My name is Bhavana Rajendran. Shakti is 501c nonprofit organization primarily focused on empowering women of South Asian community based in Greater Charlotte, North Carolina. We have Dr. Kavi Gnanasekaran, MD. She's a pediatrician with Atrium Health. She's here to answer frequently asked questions in Shakti Health Pregnancy Women Forum. This is only an informative session, not a medical advice. If you have any further concern regarding your baby's health, please seek help from your pediatrician. So let me go to Dr. Kavi. And first of all, I want to welcome you, Dr. Kavi, on behalf of Shakti. It's my honor and pleasure to welcome you for this session. Thank you for your time, and it's going to help a lot of women, especially the pregnant women in this pandemic situation. They don't get any help, especially with elders not being there to help with any questions. Thank you for helping us with that. So like I said, we have this Shakti has created this forum in the means to help pregnant women, especially this COVID situation, because the parents were not able to come and help them. So they have started this forum as a platform for question answers. They're also helping with the free food, deliver them free food for a week before and after delivery. So they are helping in a lot of ways. This is one part of the help that we are trying to give the pregnant women.
Yes, absolutely. And first, thank you so much for everything that you're doing and all of the hard work that you're all doing. I know the pandemic has made it very difficult for all of us to kind of go back to our normal things. And so I think it's great when I see people helping each other to kind of get us through these next few months. And, we just don't know what the future holds. So thank you for all that you're doing.
I just want to introduce you to our viewers. This is Dr. Kavi Gnanasekaran. She is a pediatrician with Atrium Health. And you also have a private practice in Gastonia, right?
Yes, I'm working in a practice with Atrium and Gastonia. That's correct.
Thank you so much. So let me ask you this first. Just give us an overview of what they can expect when they go to a hospital for delivery at this pandemic situation, especially in Charlotte hospitals.
You're right. There are a lot of changes right now because of the pandemic. In most of the hospitals right now, we're having mothers get tested for COVID-19 on arrival. I think, every place is a little bit different, but typically they've been testing them before the delivery process so that they know if they're positive, if they need to move them to a different room, and also to consider whether they need to kind of separate their child for a little bit or have more protections. And then once they come in and they get admitted and then they have their baby, after their umbilical cord is kind of cut and they're safely able to be with their mother, then they'll usually have them do a little skin to skin if they're doing good and they're breathing well on their own and everything is good there. And then they'll usually have them work with lactation to kind of help if they're trying to breastfeed, and they'll also during that time give them a couple of things. They'll get an injection of vitamin K, and that is to help prevent against any bleeding. They'll get some eye ointment on their eyes to prevent against infections, and they'll also get their first hepatitis B vaccine. While they're there, they're going to get tested for a couple of things. They're going to get their hearing tested. They'll also get their heart tested, so they'll have an oxygen saturation that they'll check on their finger and on their toes, hope that everything's fine there. And then they'll also get their bilirubin or their jaundice levels checked, typically before discharge. And then in North Carolina, we do test every baby for a newborn screen. And that's just looking for things that are a little bit more rare, but that we would need to do something about pretty urgently if they come back positive. So that gets sent out before discharge. And so usually while they're in the hospital, they'll have a lot of support in terms of having a lactation support there. They'll have their nursing staff, and especially a group that work with the newborns too, and often a pediatrician or an ICU attending will come and sort of see their baby every day as well and check on them for both. With the pandemic, some places are allowing them to bring one extra person, but don't quote me because things are always changing, to the delivery room as someone to be there during that time. But of course, visitation is going to be very different right now.
Okay. Oh, thank you so much. So we do have a lot of questions that was asked in the forum. So we have formatted it, and I'm just going to go over one by one, so you can just let us know, the answers. And especially, you said you wanted to give the proper information, the pediatrics information. First, what is newborn jaundice? Is it something serious, and how are they treated? Any preventive measures the moms can take ahead of time?
Yes. So newborn jaundice is caused by something called bilirubin, and all of us have a little bit of bilirubin in our blood, and it's okay because our liver can get rid of it safely. But for babies, takes a little bit longer for that to kickstart. So because of that, their bilirubin levels can get a little bit higher, and if it crosses a certain number, it can actually go into their brain and cause damage. And so that is a pretty bad thing, and that's why we watch that pretty closely. Every baby is kind of monitored in the hospital for their skin color. So with jaundice, we see that their skin color can become quite yellow. It usually starts with the eyes, and then it kind of works its way down from the eyes down to the chest and all the way down further. And then when it improves, it comes back in the opposite direction. So the last place to clear will be the eyes. So they'll be checking for that, and they'll check their levels. Things that they'll also be looking for is ensuring that the baby is feeding well and making good stool and urine diapers. And then when they leave the hospital, they'll also be checked if they need to be by their pediatrician during that first weight check. If they're gaining good weight, they look great, and they're not yellow, they may not decide to check it. But if they are having any of those feeding struggles or they seem quite yellow, typically we could do like a skin test, or we could do just a heel stick where they'll check that. And because it can be something quite dangerous if it enters into the blood, we have certain numbers that are based on the baby's hour of life. But also based on risk factors like being born early, having any genetic causes that might put them at risk, or even if their mother and the baby have different blood types. So all of those things will be kind of put in, and then based on those numbers, we can say, hey, it looks great. We'll just continue to have you feed them every 2 to 3 hours, or we may say come in tomorrow. If it kind of crosses a certain number, then we'll often have them use something called phototherapy or a Billy blanket. And what that does is it kind of breaks that jaundice down, or that bilirubin down, into safe levels, so that they'll be able to kind of get rid of it safely in their stool and in their urine as well. So things to look out for at home would be if their child's not feeding well, if their baby seems really sleepy, or if they seem like they're more yellow. Those are absolute reasons to call their pediatrician's office right away.
Okay, thank you. And we have a lot of questions regarding the umbilical cord. And so
Sure.
is there a timeline for that cord to drop? Can they give a baby bath while the umbilical cord is intact?
Yes, so usually it drops about 1 to 2 weeks after they're born. If it's a little bit longer than that, that can sometimes be the case, but we do typically recommend having them call their pediatrician's office if it seems like it's taking longer to drop. You cannot bathe them in like a water, like fully immerse them in until it does drop, and that's because it's still open. So we recommend doing a sponge bath until the cord is completely gone and it's healed. Occasionally you might see a little bit still there or a little bit of discharge as it's healing. So until that's completely resolved, we usually have you do a sponge bath first. And then in the meantime, we just have you make sure that the site is clean, it's dry, and try not to get anything in there, but also to kind of protect the diaper from getting in there as well.
Okay, thank you. And what are the measures to prevent ear infections in babies? And does breastfeeding positions or bottle feeding associated with ear infections?
Yeah, so when we think of ear infections, we often think about our little ones because they don't have a very strong immune system yet, because we haven't seen a lot yet. But also because of the way that their ear anatomy is, it's a little bit shorter, narrower, and a little bit more horizontal. So it's easier for bacteria and viruses to cause infections in the back. So things that they can actually do to help kind of reduce the chances, but not to completely prevent, because you can always get an ear infection, is number one, breastfeeding. So breastfeeding makes a huge difference because the breast milk has certain things in there that will help protect their baby. Avoiding any secondhand smoke exposure, so that's true during pregnancy across the board, but also in that first year of life especially. So having the reduction in that will make a huge difference. And then bottle feeding or formula feeding, but specifically bottle feeding, can increase the chances of ear infection. So we do recommend when they're developmentally ready to switch them over to a sippy cup. to make a big difference there. But breastfeeding makes a huge difference to kind of help reduce the chances of an ear infection. And then lastly, just make sure you're up to date with your well visits for your child and that they're up to date on their vaccines too.
Okay,
That will help.
good to know. How often should they bathe the babies? Is using powder like the baby powder or oil recommended? Any kind of lotion recommended when they bathe them?
Yeah, so in the first couple of months, we recommend bathing them about 3 times a week. They do have a lot of natural oils on their skin that are protective. And of course, babies are not going to get as dirty as some of the older kids. So 3 times a week can be just fine. Baby powder isn't recommended as much anymore, but you can do like different like oils to help as kind of a lotion. That would be fine.
Okay. There was a question about cradle cap. Is it something that they can do to help the baby not get it, or how do they treat it?
Yeah, so cradle cap could just be a very dry scalp, and there's not a lot you can do necessarily to prevent it. But if it does happen, then we recommend to continue to do the same things, to use something gentle and scented in terms of your lotion, detergent, soap, all of those things. And then you can actually take like an old soft toothbrush and use that to kind of help get some of the flakes off of their scalp.
Oh, I see. Okay. Eczema. There were some questions about eczema in their faces and in the bodies. What is eczema and how can they, treat it?
Sure. So eczema is a problem or it directly involves the skin barrier, but also it can be a sign of maybe a food sensitivity or a food allergy. So definitely if you see flares and you notice that with specific foods, it could be related to that as well. And the way that we usually treat that is to know, first of all, that it can be something that comes and goes over a lifetime. So there can be certain seasons or months when you might notice that the eczema seems like it's not existent, and then other times that it seems to be quite bad. So don't expect that it's necessarily going to get better for a lifetime, but some kids do outgrow it. So hopefully there's some hope there that it will get better in time. The ways that we usually have you treat it is if you see your child's pediatrician, they might, if it's quite bad, have you start like a prescription strength steroid cream to kind of help in some of the areas that are very bad. But also we have you use a gentle and unscented lotion, soap, and detergent. Some of the stronger scents can be very difficult on kids, and so that can make them break out more. So, anything like Vaseline, Dove, Aveeno, Eucerin, anything like that, even Aquaphor is pretty great. The thing that a lot of people forget is that detergent also can make a difference. A lot of times we like the strong smells of like Tide or Gain, but sometimes that can also break them out if they have very sensitive skin. So in that case, we recommend washing everyone's clothing, your child's and also yours if you're holding them quite a bit in that same detergent, which can make a difference. And also washing any brand new clothing before they wear it. There can be some chemicals on the clothes that they can break out to, and that can make a difference if you wash everything before they wear it. And then try to bathe them every other day if possible, because again, they have some natural oils on their skin that will be good, and it can be drying if they take too many baths. Afterwards, when they get out, just blot dry them very gently, and then you can put some lotion on top and it'll help kind of keep it quite moisturized.
Okay. So we're going to move on to the questions regarding food and formulas and stuff. So when should they introduce solid food to babies, and how do they check to see if the baby is allergic to certain food?
Yes, so this is a very great question because, again, things tend to change pretty quickly. So I do, number one, recommend if this is something that you're watching a couple of years from now to always be sure to talk to your pediatrician about this in case things have changed. But as of now, things we're looking for is that your baby has doubled their birth weight. So that's about 4 to 6 months, and that they're at least 13 pounds. We want to make sure that they can sit in like a high chair and have pretty good head support and neck support at that time, and that they're showing you that they're signs of that they're ready. If you try to spoon feed them and they kind of push that away, either by moving their head or they push their tongue out because they don't want to try it, then they're not ready yet. So we would have you stop and then wait a week or two before trying again so that they're ready, because it does require them, when they have that spoon in, to kind of push that to the back of their throat and then swallow. And so some kids may not be ready to do that yet. Usually what we'll have you do is start like rice road cereal a lot of times is your first thing, and give them a few days of that. And then try and introduce stage 1 foods every 2 to 3 days. It's good to give a couple of days in between each new food so that if they have any signs of an allergy, you know what their last new food was. The first time can be pretty mild, but after that, it can be a lot more serious if they have a reaction. So it's good to not have 4 different foods that you think it could be too. But after they've had a few things many times, then you can start to mix them as they start to eat more foods. Things to look out for once they've got a brand new food that they're trying is a head to toe rash that's very itchy, like hives. You can see them having vomiting, diarrhea. If they have a history of eczema, that might get worse, or they may have a big flare when they try that. And then more serious things could be wheezing, difficulty breathing, or any facial swelling. And those would be things to have them go to the hospital for, or call 911 if they're having any trouble breathing or swelling.
So those are serious symptoms that they can
Yes,
look forward to. Any
definitely.
recommendations on formula mix and how long they can give formula? The one mom question was how long we can give formula.
Sure. So any milk-based formula to start with is fine. Some people like Enfamil, some like Similac, Gerber. When you start that process of having a baby, times you can get some samples in the mail, so anything is fine. We do recommend starting with that first, as opposed to starting with something more expensive like Alimentum or Nutramigen with Enflora, because there's no real research to show that that can kind of keep them from having allergies. So in this case, it's fine to start them with one of those formulas and make sure it's one for infant as well. And then we would have you mix it just as the can says, unless your child's pediatrician says to mix it differently if they want more calories. So make sure you check the back of the box or the can, and that you kind of mix it. So if it says 1 scoop for 2 ounces, that you mix it that way. If you mix it and you want to use it, if you haven't had him, like your child hasn't had any of it, it should be used within that first 2 hours. But if they do drink some of it, then it's important to discard it after 1 hour because of any bacteria that might have gotten in there. And your safety is it for the first 12 months.
Okay, first 12 months. Okay. So babies having loose stool with green color, is it normal? What should they watch for in the stool colors? Like there were many questions regarding the color of the stool. What should the moms be watching? Is it something serious or should they be worried?
Sure. In their first year of life, you might see their stools change many different colors based on the things that they're eating or even medications that they may be on. The colors that we don't want to see is if it's a whitish color, and especially if it's like clay. We don't want it to be black or red or look bloody, and we don't want it to be loose and mucousy. If the stool is green, but it's soft and it seems normal without any mucus, then that can be okay. But if you notice that it has like the mucus you see in your nose in there, then that can be something concerning. So any of those colors or like very loose and mucousy stools should be reported to your child's pediatrician, and they may want you to bring a stool into the office so that they can take a look at it.
Okay, thank you. What is lactose intolerance? What diet breastfeeding moms should follow for lactose intolerance babies?
Sure. So when you're thinking lactose intolerance in the first year, that's probably more likely a cow's milk protein allergy. So babies aren't lactose intolerant per se, but there's a certain protein in the milk, whether it's formula that's milk-based or a breastfeeding mom who has dairy in her diet, they have an allergy to that specific protein. And it's one of the more common allergies, but also one that they're most likely to outgrow as they get older. If they have like mucus again in their stool, or it looks like it's got a little bit of blood, then they'll probably test it in the office when you see your child's pediatrician. And if it does seem consistent with having it, or it's positive for blood, then they'll typically have you take all dairy and soy out of your diet if you're breastfeeding. Or if you're on formula, they would usually have you switch to something more hydrolyzed or broken down, like Nutramigen with Enflora or Alimentum.
So that could pass from the mom's breast milk to the baby, the lactose intolerance too? Okay.
The dairy. So anything that's in their diet, like the dairy, will get passed
Okay,
through the breast milk. Yeah. Mm-hmm.
Please suggest tips to reduce gas problems in babies. One of the moms was saying her baby was very fussy and uncomfortable with gas issues. And she was asking about the drops, the gas drops that is over the counter in this pharmacy. What is recommended and how can they prevent the gas issues?
Yes, so gas in babies is very common, and it's because it's so easy for them to get gas. They can get gas from the way they're feeding, the way that they're sucking on like their pacifier or the bottle, or even from crying. So if you think about all of those ways for them to get gas, that's a lot of ways. And so if a baby is, you know, very gassy, then the things that you could try to do is first, if you're breastfeeding, look at what's in your diet. It could be that the caffeine could make them more gassy. You might find certain foods in your diet do it, and you can kind of keep a log on that to see what can impact it. Or you could even try to see if taking dairy out of your diet makes a difference as well, and that might help. You can also try to sort of do some bicycling movements on their legs to see if that will make a difference. That sometimes helps to get rid of some of that gas, and burping them kind of in the middle of their feet. I know they hate it when you take them out, but doing that will help to kind of get rid of some of that gas. If you have a baby that tends to eat really fast and they're really famished in between when they eat, then sometimes they'll swallow a lot of air that way. So switching to like a slow flow nipple might actually help if they're getting bottle fed, and make it so that they can only feed it a certain amount at a time. And that sometimes makes a huge difference at reducing the gas. If it's quite significant, I do recommend having you call your pediatrician's office. If you're formula fed, they may decide to look into whether or not they need to change the formula, because it could be related to the formula they're on. And if you're breastfed, then they may decide to have you try taking out dairy or testing for maybe a dairy or milk protein allergy in that as well. Gas drops have sometimes been shown to help for some kids, have not helped other kids. So certainly try them. They are over the counter, and you could try them with mealtime and see how the baby does. If it makes a difference, then it's okay. If it's not, then certainly you don't have to continue it.
Okay. How long we can keep breast milk in the freezer? What's the recommended?
The CDC recommends. The CDC recommends 6 months.
6 months. Okay. All right. Let's move on to the sleeping pattern of the babies, and how many hours generally babies sleep, and do they need to wake them up if they sleep for the long time to feed?
Sure. In the first couple of weeks and into months, babies can sleep about 8 to 9 hours during the day and about 8 hours at night. So, but the way that they get that sleep is not through like long stretches. It's somewhere between 1 to 3 hours. So in between their feeds. And so definitely when they're in between those times, it's good for them to get some sleep in there. But at nighttime, we don't want them to go too long in the first couple of weeks, because their body can't handle that with their glucose levels. So typically we recommend waking them up about every 3 hours, 3 to 4 hours.
Every 3 hours. Okay. We have one concerned mom. She had a question about baby is very restless before passing stool every time. What does she do for this? And she was worried about whether the baby is getting enough milk every time she breastfeeds too.
Sure. So stooling, we don't think about how difficult it is for babies, because we're able to use gravity and we can sit up. But in babies, they're having to try to do that when they're laying down, and it is a process that they have to kind of learn in time. So it's not uncommon for some babies to kind of seem like they're pushing down hard, to turn red in the face and seem uncomfortable for about 5 minutes. And if they're having really like soft stools and they seem comfortable in between there, then it's probably just them learning the process of stooling and not anything to worry about. But if they do seem like they're trying to strain for like 15 to 20 minutes, they're not giving you a good stool diaper in that time, or it seems like they're having very hard stools, then that would make us think that they're constipated. So at that point, it wouldn't be a bad idea to call your child's pediatrician's office to find out if there are things that they'd like to try, or even if they want you to consider changing formula and coming in to get seen at that time. So definitely, you know, that can be quite tough when babies are very uncomfortable. And then in terms of breastfeeding, I know with formula, we know exactly how much they're getting every time they feed. But with breast milk, it's very difficult to know. And everyone has different rates in how they breastfeed. So 5 minutes for one person might be a different volume than 5 minutes for another person. So with breast milk and breastfeeding, what we typically look at is how the baby's doing and how they're growing. If the baby seems quite comfortable in between feeds, and it seems like they can go about 2 to 3 hours between each feed, they seem really content in there. And when they're kind of when they get up, then they have a couple of minutes and then they start suckling or rooting, then that could show that you probably have enough, especially if you still feel like you could pump some milk afterwards. Some babies do kind of like to sleep or be somewhere in between that state and awake when they breastfeed. So if your baby's still latched on and is still suckling but seems to be falling asleep, don't unlatch them. You can continue to let them feed. That might just be their preferred way of feeding, and we wouldn't have you unlatch for that. So definitely try, and then you can even try to switch sides and see if they'll take the other side. Babies do feed when they breastfeed as often as they'd like, so they kind of do it ad lib. But if it seems like they're not content in between feeds and they're up 30 minutes or so and they seem hungry all the time, then your supply might be a little bit less. So definitely those are things to look for. And when you're breastfeeding, make sure that you're drinking lots of water and you're staying well hydrated and eating well, because a lot of the nutrition that you're getting might also be going to your baby too.
Okay. Well, we have few more questions, and so I'm going to move on to the other one. What is SIDS? How can we prevent it?
Yeah. So SIDS stands for sudden infant death syndrome, and it is a really very tragic thing to hear about. SIDS is basically considered having sudden death in an infant under the age of 1 without a known reason or an associated reason for the death. Because of that definition, there is no way to know exactly how to prevent it, but we do know that over 3,500 babies in America die of SIDS, strangulation, or suffocation in America, which is really devastating when we think about that. There isn't a way to say that we could for sure prevent it, but there are things that we know that can reduce the chances of SIDS. Some of those things include secondhand smoke exposure. So smoking during pregnancy or after the baby's born in that first year can be dangerous and can increase the chances of SIDS. So we definitely recommend everyone close by or in that household just kind of considers quitting. The other thing is breastfeeding. Breastfeeding is very protective against SIDS. So if you're able to breastfeed, that can really help reduce your child's chance and can be very protective. If they're born a little bit early, they do have a higher chance, but of course we can't do anything to change that necessarily after they're born. And then things that we know can make a huge difference is their sleeping habits. Having them sleep on their back in their own space is the safest thing for them. And that could be in a crib or a bassinet. We recommend just having a firm mattress that's flat that they're sleeping on. No pillows, no blankets, no wedges, nothing else in that bed with them besides what they're wearing and then that mattress. Co-sleeping can increase the chances of SIDS, and having anything else like a pillow could have them accidentally get on their stomach, and that in itself can increase the chances of SIDS. Sleeping on their side can also increase the chances of SIDS. So that's why it's so important that they're on their back itself when they're sleeping. So those things can really make a difference. And if it's possible to have them in the same room in the first 6 months, that will really help to protect them as well during those 6-month period. So those things will help.
Yeah, so there are some things that can help, they can do to avoid the SIDS, like the sleeping pattern, sleeping positions. Okay.
Yes.
Good to know. What does colic means? And there are a lot of questions about being, my baby is colic and the baby is crying a lot. What can they do to help the baby?
Sure. Yeah, so babies crying can be a normal thing. So remember that that's their way of communicating with us. And it's their only way to talk to us at that age. They can't tell us what they're going through, or they can't ask us to make a change. But colic is something that we think, we don't know 100% the cause, but we think it could be some difficulties with being hypersensitive to different sounds or different things in their environment, or having some difficulty with self-soothing. And especially since their immune system, not their immune system, but their nervous system is still so immature and still growing, we see it improve in time as they get a little bit bigger. It can start to present in about the first 2 to 4 weeks and tends to get the worst around 6 weeks. So at that time, you can have about 3 hours of these crying spells that last about 3 days a week. So that's pretty high. And then at about 3 to 4 months, you might see it happen about 1 hour at a time, and it might even start to resolve at that time going into 6 months. So it does tend to improve. If they're very, very colicky and they're crying quite a bit and they seem very uncomfortable, again, it's very important to talk to your child's pediatrician, because this could be a sign of a milk protein allergy or to a formula intolerance. So definitely have them take a look to decide if that could make a difference. And again, you could look at the things that are that you're eating if you're breastfeeding to see if there's any correlation there. If it's the days that you have caffeine and that's causing it, that might make a difference. Or if it's those are days that you've had a lot of dairy, again, that can make a difference if you kind of see that. And then if your child does end up having colic, and that's what we think it is, then there are a couple of things you could try. You could try to see if, having your baby and like a carrier next to you makes a difference, and having you kind of talk to them and soothe them and walk around, that can sometimes calm them down. Gently rocking them, but not shaking them, because we never want you to shake your baby at that age, because that could be deadly and really harmful to your baby, but just gentle rocking can help. If you have a pacifier, sometimes using a pacifier can help as well and can kind of help calm them down some. And then again, kind of just like singing to them or putting them in a stroller, swaddling them. Every baby's a little bit different, but sometimes you might be able to find one thing that makes a difference with the colic.
Okay, thank you. Can you give some information about newborn travel, air travel, and what are all the safety measures we have to follow when we take the baby?
Sure. So we don't recommend having them start traveling before about 3 to 6 months, and that's because underneath that age, and especially in the first 2 months, they haven't had their first set of vaccines, so they're at high risk of getting an infection while they're flying. But also it's a little bit harder for them to be able to handle that. So typically we recommend thinking about that at about 3 to 6 months. It is very important if you're going to be flying internationally to go to CDC's website and look at the destination you're going to, because at that time they might be able to tell you what outbreaks there are, and we might be able to give you some vaccines to help protect your baby during that time. If your child's under 2, most airlines will allow you to carry them on your lap and not have to pay for tickets. But when there's turbulence or any other problems, or even on a longer flight, that's not going to be a good, safe plan, because you won't be able to hold your baby or keep them safe. So really, they recommend using a car seat. So I typically recommend having you call your airline to find out what that policy would be if you wanted to bring their car seat, to have them sleep in that, which will help them be more safe, and especially during times of turbulence, to keep them safe. Trying to be on a window seat and not the aisle will make a difference, because if people are walking or moving around, they can jostle you and it can wake up your child. Or if someone spills something, then we don't want them to spill it on your baby. So definitely being out of that will be very good for them. And then dress them in layers. That way, if it gets hot in there, you can undress them. And if it gets cool, you can redress them. It's easier to deal with them when they're in layers. If you're going to bring breast milk or formula, just call ahead to find out what the limits are or what amount they'll have, and make sure you let TSA know when you're going through security that you're carrying either breast milk or formula, so that they can allow that to go through because of the limitations with 3.4 ounces. And then lastly, the hardest thing for babies is that first ascent when their flight is going up and then when it's coming down. So ways that you can help them feel a little bit better might be using like a pacifier when they're about to take off, feeding them from a bottle, or even breastfeeding at that time might make a difference to make them more comfortable during the flight.
Well, thank you so much. I have the one last question, and I think we have a couple of minutes to end the meeting. Can you give some information about vitamin D and iron drop supplement?
Yeah, absolutely. So for vitamin D, for all breastfed babies, we recommend 400 international units per day. And that is across the board for all breastfed babies. You'd be able to get the supplements in the same place that you would go to get prenatal vitamins or any other vitamin supplements. If you're getting formula, then we recommend supplementing with vitamin 1 liter of formula per day. So once they get there, then they'll get enough vitamin D in the formula to cover that amount. In terms of iron, babies have enough iron from breast milk and from growth to kind of cover them that first 4 months if they're getting breastfed. But if you're delaying starting solids until 6 months, then you might want to talk to your child's pediatrician about checking to see if they might need to start an iron supplement until they're on iron fortified foods. If you're formula fed and they're iron fortified formulas, then you should be fine.
Well, thank you so much, Dr. Kavi. It's been like 30 minutes. You have given a lot of great information, which is going to help our new moms. Actually, it's a lot of information for the older moms too to know. So thank you for your time, and thank you for helping us with the Shakti Pregnancy Health Pregnancy Women Forum. On behalf of Shakti, I want to thank you for your time. Okay.
Oh, absolutely. It was my pleasure. And of course, if you have any other questions or thoughts, feel free to reach out and I'll be happy to help.
Thank you so much. Thank you so much for your kind offer. All right. Thank you, everyone. Thank you for joining.